Good day, ma'am. We are here to present to you our chosen research topic entitled Microbiological and Pathogenic Contaminants of Seafood in Greece. Now, the researchers who conducted this study are C. Papadopoulou, E. Economo, G. Zacas, C. Salmora, C. Dontoro, and J. Apostolo, with the collaboration of Food Microbiology Unit Department, Medical School University of Ioannina, Dorothy University Campus 45110, Ioannina, Greece. The Preveza Aquaculture Station, Ministry of Agriculture, Preveza, Greece. State Veterinary Service Prefecture of Ioannina, Greece, and also the Regional Veterinary Laboratory Service Ministry of Agriculture, Ioannina, Greece. And it is accepted for the publication on November 11, 2006 and officially published on February 2007. Now, let's begin the abstract of the study. So there are 360 total samples including 105 marine fish, 25 prawns, 50 squid, 50 octopus, 30 mussels, and 100 freshwater were microbiological analyzed for the presence of microorganisms potentially pathogenic. All samples were examined the standard biological procedures. The isolated microorganisms were Aeromas hydrophila, 38 to 93%. The percentage after the name of bacteria is the total percentage of the samples positive on contaminated by the bacteria. Klebsiella ozonei, 1 to 40%. The Escherichia coli, 14 to 87%. The Yersinia enterolotica, 0 to 40%. The Hafnia alveoli, 0 to 36.6%. Enterobacter aglomerans, 0 to 42%. Citrobacter farinae, 0 to 46%. The Proteus vulgaris, 15 to 80%. The Proteus mirabilis, 7 to 82%. The Morgella morgani, 0 to 30%. The Pseudomonas fluorescens, 0 to 34%. The Pseudomonas putida, 0 to 6%. The Plisonias shegaloids, 0 to 4%. Listeria innocua, 1 to 3.3%. The Vibrio parahemolyticus, 0 to 2%. The Clostridium perfringens, 0 to 1%. The Staphylococcus aureus, 0 to 80%. And Candida quellermondi, 0 to 1%. Candida albicans, 0 to 1%. The Pendiculum auxilium, 0 to 1%. And the Penicillium italicum, 0 to 12%.
Now, why did they conduct this study? For some reasons, it's because of the recent food scares that has related to ruminants meat, chicken meat, and the dietary changes of the consumers toward healthier food habits that has been resulted in a rapid rise of the seafood's consumptions worldwide. Before kasi, the marine and freshwater fish they did not consider it as an important human pathogens. That's why eating raw seafoods or raw fish is not a serious problem that time. So the contaminated seafoods has been implicated in foodborne outbreaks in many countries. The majority of them have been caused by bacteria, viruses, histamine, and marine biotoxins. Although the inadequate cooking will such as boiling, steaming, or frying will inactivate them, but the improper handling or the cross-contamination or the eating raw seafoods habits might pose to a health hazards, especially sa mga mahihina yung immunity, elderly, and children. So, the main purpose of this study or the main objectives of this survey was to generate information on the prevalence of the pathogenic and potentially pathogenic microorganisms which under suitable condition that might cause mild to severe public health problems.
So now let's proceed to the materials and methods. So this study was conducted for 1 year from August 2004 to August 2005, where 360 samples collected and analyzed microbiologically. So 260 samples coming from seafood, which are 50 from squids or Loligo vulgaris, 50 from octopus or Octopus vulgaris, 25 from prawns or Peneus keratosaurus, 30 from mussels or Mytilus galloprovincialis, and 105 from marine fish. That includes sardines or Sardina fulgentus, of course the hakes or Melicius, the mullets or the Mengelcephalus, mackerels or scamber, the bogs or the boops, and the silverside or Atherina hecpectus, and 100 troutfish or Salmotrota coming from freshwater. So all samples were obtained from retail stores of northwestern Greece and captured from Ionian Sea. Then the samples were collected within 24 hours of capture, placed into sterile containers, and were transferred to the laboratory at 400 degrees Celsius using the insulated transport boxes. So the following microbial pathogens were analyzed microbiologically. So namely the Vibrio spp or the species pluralis, Salmonella spp, Listeria spp, the Pseudomonas spp, Clostridium perfringens, the Staphylococcus spp, the yeast and the molds, and also includes the enteric indicator organisms. These are the members of the Enterobacteriaceae family and the Enterococci. So to identify these pathogens that I mentioned, the researchers use a different types of standards system, which are the API-NE, API-20E, API Staph, API Listeria, and API-CHAUX. So the microbiological procedures included the homogenization of 25 gram of each sample. So if seafood, it is from its flesh, while sa fish naman, both flesh and skin. So put it in 225 ml So upper page siya sa broth by using the ISO method. So what is ISO method? ISO method is used in separating a single species of microorganism from its natural habitat, growing it by itself without interference from other organism. So for example, sa Salmonella spp, they use the ISO 6579. Tapos sa Staphylococcus naman spp, they use ISO 6588 1983. For C. perfringens naman, ISO 7937 1997. And for the yeast and molds, they use the ISO 1754 1987. So the researcher's purpose to have this method is to observe and study each microorganism if what possible affects it to the human health.
This paper is the basis result that presented in table the incidence of microorganisms that isolated in seafood and seawater in Greece, and also this table. So, the concerning pathogens causing severe infections like the Salmonella species plural was not detected in sample that examined. The Vibrio parahemolyticus was detected in 2 samples of fish like the bogs and the cuds. And Listeria innocua also detected in 2 samples from mussels and river trout. And Clostridium perfringens, only one selected in sample that is the freshwater is trout. So, the most commonly isolated species are Aeromonas hydrophylla, followed by the Proteus, Proteus vulgaris, Proteus mirabilis, and Morganella morgani. These are the members of Enterobacteriaceae family. Plesiomonas shigelloides was isolated from both marine and freshwater fish, while the yeast and the molds only isolated from freshwater fish, and Candida albicans only isolated from marine fish. So the contaminated seafood is mussels. The data showing that the highest frequencies are Escherichia coli is 100%, Proteus vulgaris is 96%, and Proteus mirabilis is 92%. The isolations and harboring pathogens of public health importance are such the Yersinia enterocolitica is 40%, the Staphylococcus aureus is 56.6%, And Pseudomonas fluorescens is 26.6%, and the last is Listeria innocua is 3.3%.
So, in conclusion, it is not advisable to eat uncooked or raw fish for seafood, especially if that seafood or fish were captured from a polluted habitat. Yes, there was no pathogens causing severe infections detected in the study like Salmonella species. However, there were a lot of bacteria detected in the study that's still risky to our health. So, for instance, the Aeromonas species. Aeromonas species has been recognized as potential foodborne pathogens for more than 20 years. Aeromonas hydrophilia, it has been associated with foodborne diseases such as gastroenteritis diseases or the extraintestinal diseases such as meningitis, sepsis, pneumonia, and urinary tract infections. So, in other case naman, for example, we have the Pseudomonas shingilloides, a bacteria that can cause gastroenteritis that is sometimes asymptomatic. So, it means that if you consume that kind of pathogens accidentally, you can't know because there is no symptoms of cure. And usually, patients develop an acute gastroenteritis. While in Listeria inocoa naman na bacteria, so it is a referred to us as non-pathogenic microorganisms, for example, for human. But recently, it has been described in association with human disease. A case of fetal bacteriemia caused by Listeria inocoa in a 62-year-old patient was reported in 2003. So, nangyari ito sa France according to Perin et al. To 2003. So, this phenomenon on non-pathogenic microorganisms turning into pathogens is attributed to the increased ability of the microorganisms to adapt to the new host and to the increased of the numbers of immunosuppressed or immunosufficient subjects who are vulnerable of these opportunistic infections. So, in molds and fungi cases, this kind of microorganisms has no severe effects to human. However, the food poison caused by these microorganisms can trigger other disease of human like meningitis. So in other words, cooking such as boiling, steaming, frying your fish or seafood is best way in eradicating the bacteria in the fish or seafood. So, for instance, in Aeromonas hydrophilia, it stated in the study that it is psychotrophic. So it means it is able to grow in foods during cold storage. However, it is not resistant to food processing regimes and is easily killed by heat treatment. So, in case of naman sa, like for example, sa sushi. Sushi is a Japanese dish consisting of small balls or rolls of vinegar flavored cold cooked rice served with a garnish of raw fish, vegetables, or egg. So, the raw fish that is used in this dish is usually a salmon fish. So before they serve that kind of fish, they use those technologies such as the cold plasma activated water, and electrolyzed water, as well as the use of innovative packaging and I mean, edible coatings to improve the shelf life and the quality of the sushi meals. It is according to Kulawik 2020. So, in addition naman, one of the method used in preparing this sushi is they stored it in cold storage with a temperature of negative 24 degrees Celsius. So, those are the reasons why sushi is safe to consume for human. Or, yes, yun.
So that was the summary of the study entitled Microbiological and Pathogenic Contaminants Seafood in Greece. The abstract was delivered by yours truly, Mr. Olugin. The introduction and the objectives was delivered by Ms. Zamoras. The materials and method was delivered by Miss Haron. The result was presented by Miss Ismael. And lastly, the conclusion was delivered by Miss El Kamel. And that would be all. Thank you for listening, and once again, good day.